Dr. Yates. This is one of my good friends. Do you want us to say your name? We can call you something else.
Say my name.
We call him Big G. Make it easy. Call him Big G because we don't want people to know his name. They'll be Facebooking him, and then I know his wife, and stuff happens. Okay, so we just call him Big G. Okay. The reason we're going to talk about him today is because I just got off the phone with the patient who is from a different city. Scott's over there. Scott, what city was that patient from that said she had checked out about doing African American hair and all the specialists? She called me number 10. I was like the 10th call.
Yeah.
But where was she from? Atlanta, DC?
I think it was Atlanta.
Somebody from Atlanta, DC called us 10, and that's great. I was glad I was in the running, number 10. And I asked her, what is everybody saying about African American hair? And Eugene, you're African American, right?
Yes, I am.
Okay. So I said, what are people saying about that? Well, they're saying that you got to do a strip because if you do African American hair, you're going to cut it and it's not going to grow. And what else did she say, Scott? And these are her words. I didn't make this up.
Right. Just that success rates are
less.
They can get
Nobody
more
knows.
hair.
They can get more hair. Nobody knows what they're doing.
Yeah.
And I listen intently, because there's always two sides to every story. So here's my side to that story, okay? Doing African American hair is more difficult than doing non-African American hair, okay? That's number one. Number two, some people are better at doing it than others, and you have to know your limitation. I can only speak about what we do, okay? I do FUE on African American hair all week long, and we have gotten very good at getting reproducible results with the right patient without doing a strip. Why would you want to do a strip as an African American patient? I want to tell you a couple things. The incidence of a keloid scar, which is a big thing that looks like the hot dog on the back of your head, is higher. The incidence of bad scarring is higher, and everybody wears their hair low, and you're going to have a big line in the back of your head. Now, if that makes sense to you, that's okay. But does that make sense to you, Eugene?
No, not at all.
Not at all. So why would you want to have a big cut in the back of your head? Have a big thing I've seen big as my finger. It looks like a sausage on somebody's head because of whatever reason. So I want everybody out here to become a thinker. Just don't go on the internet and get bamboozled. I want you to really think about the things that are at hand, okay? And always, you want to look at a live patient. Eugene's had a hair transplant by me. We did FUE, and this is what Eugene used to look like before, 2-3 years ago. I can't even remember. Turn it around, Eugene, to make sure I'm not making up stuff. Is that you or is that not you?
Ooh, yeah, that's me.
That's him. Zoom in on this picture. This is Eugene's hairline. Eugene is what we consider, I don't use African American because hair is Afrocentric, meaning that the follicle isn't straight. He has Afrocentric hair. I have Afrocentric hair. But you can see the result. We did the front. I can't remember now, maybe 1,000, 1,200 grafts, and his hair looks impeccable. Turn around, Eugene, just a little bit. The back, none of these lines or nothing. He can wear his hair as low as he wants in the back. You can turn around, Eugene. And that's important because everything's options. Who wants to get a big cut in the back of their head and have to worry about telling your barber to cut a 3 to a 5 to a 1 other than just going to your barber and say, hey dude, line me up. So my point is that the internet is great, but the internet is not fact-checked by anybody medically. Anybody can say anything on the internet. Just like I can say I'm the best hair transplant doctor in the universe, which I believe that's true, but there's no way to fact check that. And the way you decide who really knows what they're doing, just like who builds the best house, what do? Do you just go on the internet and take their word? Absolutely not. You go around and you look at the houses and you look at the trim. So I'm actually challenging patients to get smarter, and hopefully our phone call, Scott, will get smarter.
Right.
And we won't be number 10 on the list and somebody talking about a scar, okay? So, African American hair, it's more challenging. We accept that challenge. We're very good at it. Some people we do turn down because there's some things out there called scarring alopecia, which doesn't work that well. But for patients like Eugene, he can have an excellent result. We're going to do some more and thicken it up some more. So you'll be seeing pictures of Eugene in the next 6 months. So any questions you have, we're in the middle of the United States. Every airline flies here. So you have no excuse not to come here. You just don't want to go to who's ever in your state because they're there. because the stakes are too high. You know, just like I go to different states to do different things because the stakes are too high. I'm just not gonna go to Chicago to get something that I know somewhere else is better. It doesn't work that way, especially as you get older. Come see us, come call us. We're always available to talk. This is Dr. Yates, this is Big G, and Scott's over in the corner.
Hey guys.
A lot of people, when they call, they speak to Scott. Scott's been with me forever, you know, but I want everybody to think, really think, and just stop listening to what people are saying, okay? Talk to you soon.